Hi, I'm Sarah Key, coming to you through Salford University. I just want to give you a brief rundown of what my masterclasses are all about. Stage 1 and 2 really are a cascade of breakdown, I propose, that happens when a disc starts losing compliance, starts losing the ability to be able to suck and squirt and feed itself, and so that you start getting features that play out and cause other recognisable spinal syndromes. Now, the vast bulk of spinal problems fall into what I call the category of a stiff spinal segment. I believe this is the underlying etiology behind low back pain of unknown etiology, or simple back pain, or non-specific back pain. And really, there's nothing, I believe, there's actually nothing wrong with the disc at all. The disc is simply injured, a minute microtrauma of the outer annulus, which is the tensile part of the disc, also has a nerve supply and a blood supply. It's like a ligament. It's relatively easy for you to do stuff, or patients to do stuff, that hurts that, and that then stops that disc being able to suck and squirt. Because the disc doesn't have a blood supply, it's very dependent on this concertina movement at all the spinal levels to keep a circulation going through. If you don't have that, then you start deteriorating. The health of the disc starts to deteriorate. Now, the first condition is, as I say, a stiff spinal segment. The final stages of a stiff spinal segment I have nominated, we then call degenerative disc disease, when the nutrition of the disc has been so impaired by this lack of extensibility of the outer skin of the disc that it's basically self-starved. This is uncommon to deteriorate to this degree. Much more common is the problem up this end, which is simple stiffness of an otherwise completely healthy disc, and a disc that's of normal thickness or width. But it's tender, it's sore, and we can palpate the vertebra sitting on top as more sluggish, more stiff, feels sore to touch. If the condition starts to move out of the first stage, out of this 90% of cases of low back pain, simple low back pain, it is because features of the stiff spinal segment start to manifest, and that will cause other syndromes to become more apparent. The first one is facet joint arthropathy. Now, if the disc can't feed itself, it will slowly starve. Eventually you will get thinning of the disc itself, which means that the facet joint itself takes load which it's not designed to do. Facet joints are movement controllers. They're not really meant to take a lot of load at all. They swell if they are subjected to too much load. Usually the provenance behind facet arthropathy is that the central core, the vertebra sitting on the disc, is stiffer, and that leads to swelling of the facet capsule. Because it's not compliant enough, in turn that stiffness has spread to the facet. Commonly, with chronic facet arthropathy, there is adhesion formation as well, hard to recognise. Now, the two most common spinal disorders, stiff spinal segment and facet arthropathy, really the vast bulk of spinal problems. I go through with you how you diagnose this, what it feels like, enhanced palpation skills to be able to feel if a segment is hypomobile, whether it's sitting off centre, whether it has unequal play from left to right. I also then go through facet arthropathy. What are the features of facet arthropathy? The way one palpates the facets, really enhanced palpatory skills are taught. And then we go into the other less common spinal syndromes, which are just as daunting to treat, but much less common. The third is what we call acute locked back. When you lose water content of your disc because it can't suck and squirt as much, then you have a latent lack of pressure within the discs. And that can lead, if you're unlucky, to this slight subluxation of the facet joints at the back, often directly related to poor tummy control, so often goes with a feeling of being unfit or unwell, and lack of tummy strength often means that you can't activate the muscle spindle at the back, or it comes to the fore if you're trying to bend with a straight back. Another story completely in stage 3 is lifting and bending. Highly important in terms of re-educating backs back to normal. Prolapsed intervertebral disc is stage 4. The other feature of a stiff spinal segment is that load is transferred from the nucleus at the centre, which is the main load-bearing part, to the walls at the side, or to the annulus fibrosus. If the disc is dehydrating, the nucleus literally shrinks like the sun going below the horizon. Load transfer to the walls, that breaks up the walls. At the same time, the nucleus loses cohesion. It changes in molecular structure. And so then it's easy for the nucleus to actually track out of the centre of the disc through cracks that develop in the wall. Not common at all, very infrequent, prolapsed intervertebral disc. Sequestration is a good outcome. It happens when the disc actually bursts, rather like a boil bursting, which we go through. The treatment of it again, how to recognise it, what the signs and symptoms typically are, and what the patient can do themselves. All these conditions have a big component of what the patient can do themselves. And the stage 5 is the unstable spinal segment, or spinal instability. Really is the sort of near end stage culmination of the disc becoming less competent and the 2 facet joints at the side. With reducing pressure, the disc can't control its segment sitting on top as well. It tends to slew rather than tip, and that renders less competent the facet joints which are trying to hold at the same time. Once they all get stretched and rendered less competent, then the segment becomes unstable. And then, once again, all the signs and symptoms of typical instability. It's very much overdiagnosed and not very common at all. Multifidus is really important in controlling instability. We'll be taking you all through that, the various different grades of multifidus re-education, because really instability has to be controlled actively through more competent muscle support across that weak spinal link. And then stage 6, which is actually a new stage that has come into being since my book, The Back Sufferer's Bible. It's really ankylosis. It's really when you've got a segment that's very thin, degenerative disc disease in its sort of zenith form, if you like, when really you need the development of bony outgrowths, osteophytes, to create a bony union across that very weak lumbar segment, which is why it's so important that physios just don't hammer away mobilising, because really nature is trying to stabilise that link. It's important that you recognise if there's been past instability. Again, all the features and signs and symptoms of instability, what you can look for, and the way to treat it, both in its acute and chronic form. And the acute and chronic form for all of those spinal conditions. And then we take you through, obviously a big part of the Sarah Key Masterclasses is the fact that I mobilise the spine using my foot. Really the most superb instrument. Saves the hands, just as effective if you've got any form of ability with your hands. It's but a small thing to actually educate you as competent physios into using your foot, which is much easier on you. And then the final element of the masterclasses is taking you through how to use a back block so that patients can decompress their spine. They must be able to be self-treating. A salient part of the Sarah Key method is really that a huge part of the treatment is done by patients themselves at home. Yes, we have to mobilise. Yes, we have to set them up, make their spinal segments work better. If they're hypomobile, make them work better. If they're loose, knit them up. But then patients have to be self-treating. This is all in stages 1 and 2 of the masterclasses. Stages 3 and 4 are crisis conditions, and all sorts of other goodies for you to avail yourselves of. Hope to see you.